And the first one, watu kukuja mchana na kuua mtu na kukimbia na pesa, the first one. In the past incident tumekuwa na watu wanavamia duka usiku saa 2 saa 4 usiku na but ya mchana to daytime since I'm 40 almost 50 years is the first thing to happen. So ilipata watu wetu weko wanaware, they are scared, so ilituacha tunabutua. So
imekuwa mida ya saa 7 tukasikia risasi ikipigwa. Tulipokuwa tunajieleza ni nini, nikaona huyu msichana Anet akitoka kwa MPESA akiwa ameshika tumbo. Nikasema si ni Anet. Kidogo risasi ya pili nikaona akaanguka kiinua miguu juu. Katika hiyo hali nikaona ameanguka, na watu wakaendelea kupiga marisasi. Hata vijana wetu wa bodao wa stage ya Mwembe walijaribu vile wanaweza, lakini risasi wakapiga mahali pale, ndio hao vijana wetu wakaweza kutawanyika.
Leo nimepoteza mfanyikazi na nimepoteza pia pesa katika duka langu la Mundika, na hii maneno imetokea wakati wa saa 7 hivi, ndo nimepigiwa simu ati duka lako limevamiwa. Wakati huo nikachukua pikipiki kwa haraka kufika hapa. Nilipofika nikapata mfanyikazi wangu amempeleka hospitalini, amepigwa risasi na watu asiyowajua.
Hapo kwa chief walirentisha waliekama watu ndio wanalalanga ndani. Na ingine ni corruption yenye hapa. Ukitaka kupata kitu ati lazima utoe pesa. Lazima utoe pesa ndio usaidiwe. Alafu pia security light pia hata ikifika usiku wamama pengine wakitaka kuuza mboga wanasumbuliwa na giza sana. So tunaomba serikali mjue kitu yenye.
Now, the Senate Health Committee has recently conducted a 2-day visit to Lamu County to evaluate and identify the challenges facing hospitals in the region. The visit is part of ongoing efforts to ensure that residents of Lamu have access to quality healthcare services. During the tour, committee members engaged with the hospital staff, observed service delivery, and gathered information on infrastructure, medical supplies, and staff needs. The insight gained will inform policy recommendations and initiatives aimed at improving health services from the local population.
Cha kuhuzunisha zaidi nikimalizia ni jambo la mochari. Hospitali hii ya level 4 haina mochari. Mgonjwa akipoteza mpendwa wake, ambebe yeye mwenyewe, ampeleke hospitali ya Mpeketoni, aweze kuhifadhiwa pale mpaka familia iweze kupanga vile itampumzisha. Na ni jambo ambalo linahuzunisha kwa sababu mochari ni kitu ya kuweka priority.
Kwa hivyo tulikuja, tumetembea kwa mahospitali, tunaenda King Faisal, tumeenda hii hospitali nyingine mlihitaje? Peketoni, tukaenda Witu, na haja yetu ilikuwa kuja kuangalia county imefanya kazi vipi. County ya Lamu imekuwa ikijishughulisha vipi. Haja yetu kuja hapa ni kuja kuinvestigate.
Toka uhuru uanze wa Kenya, kwa mara ya kwanza Lamu County tuko na vitanda 6 ICU. Lamu County sasa iko na kiwanda chake cha oxygen, cha kuzalisha oxygen, na ambacho tumenunua kupitia mgao wa county. Kiwanda kizuri sana kiko hapa tayari, na mabadiliko mengi ambayo yako hapa, lakini zile administrative issues ambazo zimeonekana ni vitu ambazo zaweza kurekebishwa hapa na pale, na tunaenda tukirekebisha polepole.
We have issues with SHA, tutafuatilia. We have issues with Minet, ACDC. They need to pay you. You have issued with the National Youth Service. You are treating the people and they haven't paid. Those, the committee and the Senate will write a letter to them directly.
Now, Governor Paul Otuoma has urged Busia residents to support President William Ruto for 2 terms in office. The remarks comes as President William Ruto launched his Western Kenyan Development Tour, focusing on projects aimed at boosting infrastructure, agriculture, and local economic growth. Governor Otuoma said supporting the president will help fast-track development in the region.
Siruto ametusaidia. Sasa sisi tena tunaenda wachana na Ruto, tunaenda kumandamana. Sisi tunajua pale tuko. Siraila alituacha kwa broadbase. Na broadbase sasa ikakuwa rafiki yetu ndio yuko pale. Tunasimama na Ruto. Tulielewana aje hapa iko mtu wa hii? Sikila mtu ni hii. Kwa mama mnasema aje?
Now, 4 people have been confirmed dead following the collapse of a condemned 5-story building in Shaurimoyo yesterday afternoon. Authorities say the structure had previously been marked for demolition after it was established that it had been built on riparian land, making it unsafe for occupation. Officials have launched investigation into the incident, with questions emerging over why the building had not been demolished despite prior warnings.
Kuangalia sana kuhusu hata bibi kwanza ile vumbi ilikuja kwanza, naweza kwanza nitulie kwanza nikaa hapo kando.
Nyumba ilipoanguka asubuhi, kama rescue ingekuja mapema hao watoto wangekufa.
Kwa juu hata kushuka hata mimi Mungu hata nashukuru Mungu, mimi nikushuka nilishuka. Hata nilikuwa nimetomwa shada na wana mamori yangu, mimi nikasema ndio ni
Nataka kuuliza Ruto kitu moja. Mbona hizi building anabomoa nusu na aliamua kubomoa Blue Estate mzima? Ingekuwa amebomoa ameangusha yote au vijana wangekufia hapo.
So tunaomba tafadhali angesimamisha kwanza watoto wakifunga shule aendelee na ubomoaji. Sasa tukatae ubomoaji. Alafu vijana wengi wana kazi. So ukipata hii jengo imeanguka sababu watoto wa vijana wengi wako idle na walikuwa wanatafuta kitu ya kukula.
Now, authorities have issued eviction notice to residents living along Nairobi's river and waterways as part of a joint national and county government strategy to tackle frequent flooding. The move is aimed at reducing risk and preventing property damage during the rainy seasons. However, the directive has drawn criticism from some affected parties, including local traders in the Grogan area, one of the neighborhoods hardest hit by floods. Business owners argue that the relocation endanger their livelihoods and are calling for an alternative solution that balance safety with economic survival.
Maji kumaanisha ya kwamba ile faida tungepata yote imekuwa ni hasara kwetu. Injini moja kama inaenda na 1,100, hiyo ni kumaanisha itabidi tubomoe ikuwe ni spare parts.
Itabidi wasonge kwa sababu tutaondoa hizo nyumba. Tumeleta pamoja zile equipment ambayo tunahitaji kufanya hiyo kazi. Na ni watu ambao wanajua wamekaa pahali ambapo hawafai kuwa. Lakini pia long term tunatumia teknolojia GIS kufanya mapping ya zile maeneo ambapo lazima watu wasonge.
Wanatengeneza mto, wakakuja wakachukua red soil, wakamwaga chini, wakachukua mawe wakapanga juu. Maji ilichukua mawe zote ikaweka kwa daraja. So ikakuwa imefunga hizo ni za kuingiza maji. So inabidi sasa maji inashindwa kuenda, inarudi back. So ikirudi back ni kuchukua hii line ya biashara huko.
Sio tutakuja hapa kutufukuza juu, huko ndio pia tunatafutia. Sasa wao kwa wanaweza kuja tu wajenge hiyo road juu. Kiangalia pale mbele kuna venye China alijenga hiyo maji kwa sawa, hata haiwezi toka nje. Lakini hapa inatoka nje kwa sababu haijajengwa. So kama wanaweza tujengea tu hiyo maji iflow tu kwa line yake.
As for the mechanics around Grogan, we have been having a long discussion with the Rivers Commission on relocating those garages. They will have to be relocated because they are right on the riparian. We are providing alternative land in Ziwani where we can actually set up these garages, as well as, remember, it's an ecosystem. So you have garages, you also have spare part shops.
Now, Member of Parliament Fukiharu Ndidinyoro has criticized the State House for its high budget. The State House budget, now set at 16.9 billion shillings for the 2025-2026 financial year, has faced continued criticism as it's nearly double the original allocation of 8.6 billion shillings. Speaking in Kabirwa, Murang'a County, Nyoro stated that the government cannot continue prioritizing unnecessary high expenses while ignoring the basic needs of citizens. He argued the government to direct national resources towards development and essential public services, emphasizing accountability and prudent use of taxpayers' money.
Thank you.
We cannot have one office being allocated 17 billion Kenya shillings. Now when I decide the next financial year, 20 billion shillings. Office moja. That is money enough to confirm all our JSS interns, all the 44,000, into permanent and pensionable terms. Badala ya hizo mabilioni zinawekwa katika ofisi moja. Mimi nauliza wadosi wote tafadhali.
Now, moving on, the coalition of doctors from a National Hospital Association has formally appealed to President William Ruto to step in and mediate the ongoing dispute at Nairobi Hospital, the country's largest private healthcare facility. The doctors said their request was made with genuine intentions to stabilize the hospital and safeguard patients' care amid the unrest. The medical professionals emphasized the urgent need for presidential intervention to ensure uninterrupted services, maintain operational efficiency, and prevent further disruptions. Their appeal highlights growing concerns among healthcare workers over the impact of the dispute on the patients and the wider healthcare sector.
Audited accounts which have been published of 2024, those are the latest audited accounts that we have indicated that the hospital had suffered a loss exceeding 3 billion, with a deficit of approximately 2 billion in 2024 alone. Okay, it's estimated that the hospital owes suppliers in excess of Kenya shillings 4 billion, and some suppliers have suspended delivery of essential drugs and medical equipment to the hospital.
We fought to get on, not because we were trying to make money, because we wanted to give back to this wonderful hospital that had gone from a nursing home to be the hospital in East Africa.
Our concern has also been about the manipulation of the members' register. You have in mind that the Kenya Hospital Association, which owns Nairobi Hospital, is a membership organization, which means that the members on the register, that we have a membership register which must be legitimate, because those are the legitimate owners of the hospital as in trust by the public.
And still on that, Health Cabinet Secretary Aden Duale has confirmed the government's involvement in mediating the recent tension surrounding Nairobi Hospital. Speaking in Mombasa, CS Duale urged the public that the hospital remains a private institution and that the government's role has been limited to facilitating smooth operations and supporting service delivery in the country's largest private hospital. He emphasized that the intervention was strictly aimed at resolving operational disagreements and ensuring continuity of patients' care, dismissing claims of government's overreach or plans to take control of the facility.
Nairobi Hospital First is facing serious financial mismanagement and bad governance. That is the reality. Let us not bring politics, let us not bring other issues. And again, it is facing very serious clinical governance. And I have directed Kenya Medical Practitioners and Dentists Council this morning to go and do an audit of its clinical infrastructure. They have sought my intervention as a minister. They have sought the intervention of the president on a number of times, including last week. And the government directed investigation authorities to probe the ongoings at that hospital, from bad governance to tax evasion to corruption and many things. So neither the president nor the Minister for Health nor any government official has any interest. We have absolutely no interest. Our interest is only one. How do we preserve the first-class national and regional health facility that is in our country? So in any case, Nairobi Hospital cannot be acquired by anyone, as there is no shareholding. It is a company by guarantee. So I really want to ask my colleagues, the ones that I have served with them in politics many years, let us not politicize the health sector.
Now, the Director of Public Prosecution has filed multiple criminal charges against doctors implicated in alleged mismanagement at the body overseeing Nairobi Hospital. The accused face allegations including conflict of interest, receiving unlawful benefits, and failing to comply with financial reporting requirements. According to court documents, Chris Bichanga, the former director of the Kenya Medical Association, along with Samson Kinyanjui, are accused of receiving millions of shillings from an insurance agency contracted by the association that manages the hospital. Additionally, Dr. Chris Ombaka faces charges of accepting benefits from a third party in violation of company law.
The age of the accused persons, I've noted their age, especially Dr. Obwaka, and I've also noted that these are the people who cannot be called flight risks. For those reasons, I have allowed personal bond of Kenya shillings 5 million with the 2 contact persons, and that the accused should attend court without fail when required, failure which the bond will be cancelled and strict terms imposed. The defense will be supplied with witness statements and any documentary evidence being relied on by the prosecution, and we'll have pre-trial on the 31st of March this year.
The President-elect can thank the court on behalf of all the defense.
Your Honor, we thank the court for dealing with the matter expeditiously once it came to your office. The accused persons are going to comply with the request, and we ask that the court be available so that that can be done and it can be immediately released.
Thank you. I also thank you for your patience.
Now, allow us to take a quick short break and don't go too far. Now, in business news, the Cabinet Secretary for Cooperatives and SMEs, Wycliffe Oparanya, has announced that the National Youth Opportunities Towards Advancement Program, or NYOTA program, is funded through a World Bank loan. Speaking in Busia County, he said the program targets over 800,000 youths by supporting jobs and entrepreneurship. He noted that the funds are a loan to be repaid by taxpayers, raising concerns about public debt. The remarks comes as President William Ruto launched his Western Kenyan Development Tour.
Project ya NYOTA ambaye rais ameleta ni ya serikali ya Kenya. Tulipata mkopo kutoka World Bank na Wakenya watalipa hiyo mkopo. Hiyo ni mali yenu, mshikilie hapo, tuendelee mbele.
22,000 today, 22,000 in future. Total savings ya NSSF 3,000 today, 3,000 in future. Ukipiga hesabu 50,000 pesa ya NYOTA. NYOTA ni fire si fire.
Siasa ya Kenya imebadilika. Unajua kuna watu wamechelewa na akili ya zamani. Wale watu wanajifanya sijui United nini. Nyinyi mmesikia hawa watu wanazungumza mambo ya fitina, mambo ya sarakasi, mambo ya matusi, sijui Ruto hii, sijui Ruto ile, sijui Ruto ile. Mimi nataka niwaambie, Ruto ni mtu mmoja.
Barabara ndio hiyo, soko ndio hizo, affordable housing ndio hizo. Tutakuwa na rafiki mwingine kuliko huyo? Ati sisi tuache Ruto tena tuende msitu?
Ninyi ni watu mtashangaa sana. Hawa watu tutawamalizia asubuhi na mapema.
Now, transport sector players are now advocating for an adoption of telematic systems and the establishment of dedicated training institutions for drivers and conductors as part of efforts to reduce road accidents. Speaking during the 4th Sustainability Seminar hosted by Isuzu East Africa, industry leaders led by National Transport and Safety Authority emphasized the urgent need for research-driven policies to improve road safety. They noted that integrating technology such as telematics can help monitor driver behavior, enhance fleet management, and promote accountability on the roads. At the same time, stakeholders highlighted the importance of structured training programs to equip drivers and conductors with the necessary skill, discipline, and knowledge to ensure safer transport systems.
When a driver is being monitored by technology, then you are going to be able to track the behavior of the driver when it comes to harsh braking, harsh cornering, freewheeling. You can be able to see the data of a particular driver, the accidents that are caused by a particular driver on a particular route, why are some drivers causing accidents and why are others not causing accidents, and you can be able to have specific intervention report by driver.
We shared insights on perhaps the opportunities on the role of technology in enhancing and reducing road carnage. So for instance, how do we leverage data analytics, telematics in ensuring that we get real-time reporting?
For Kenya numbers is that of course we talk about 4,000 deaths every year. That is unacceptably quite high. As we always say, one life lost is one too many. And that's why we want to partner with all the stakeholders, both within government, outside government, in the NGO, in the academia, in the
And the Cabinet Secretary for Roads and Transport, Davis Chirchir, has inspected the launch preparations of the standard gauge railway extension in Kisumu ahead of its official commissioning on Saturday, March 21st. The event is expected to be presided over by President William Ruto alongside Ugandan President Yoweri Kaguta Museveni, signaling a significant step in enhancing regional trade. According to the CS, the expansion of the railway line is poised to enhance business opportunities, improve transportation efficiency, and stimulate economic growth not only in Kenya but across East Africa.
Here, our President, Dr. William Ruto, His Excellency, and the President Yoweri Museveni to come and do the groundbreaking for the standard gauge railway. Another extension from Naivasha to Kisumu and eventually to Malaba, some 369 kilometers of rail, standard gauge railway. A very, very significant.
And Africa's retail forex market is experiencing rapid growth driven by a new generation of young tech investors. Mobile trading platforms and artificial intelligence tools are transforming how people enhance with financial markets, making trading faster, more accessible, and increasingly automated. Analytics estimate the sector could expand by up to 30% this year, with nearly 70% of active trade now relying on AI-powered systems for automated training and risk management. These tools allow users to analyze market trends, execute trades instantly, and minimize human error. However, experts caution that while technology is lowering barriers to entry, it also introduces new risks. Increased automation can lead to higher market volatility.
It's important to notice that 70% of institutions, these are the smart money investors, are trading using AI. With AI, we can automate it so that the bot now does what humans used to do when it comes to trade analysis and execution and even risk management.
The reason we're doing this is to increase on the financial literacy across the Kenyan people, especially on matters forex trading. People haven't really taken it as a business. It is a business and people make money out of it.
Pesa nyingi ambazo hata sometimes unapeleka kwenye benki, unaambiwa hizi pesa baada ya muda fulani zinazaa kiwango.
And more than 500,000 women and youth in Embu and Kirinyaga counties will benefit from a climate-smart agriculture financing program. Speaking in Kirinyaga Rainforest Alliance County Director Marion Nganga said mainly rural women and younger people have been left behind due to gender stereotypes, patriarch systems, and limited access to technology. The initiative aims to provide funding, training, and digital skills to help them adopt sustainable farming and improve their livelihoods.
Close to 2,500 farmers in Embu and Kirinyaga counties with the intention of increasing productivity of our coffee and tea farmers through climate change adaptation, through regenerative agriculture technologies.
Technology and digitization that would help them access affordable and innovative finance through fintechs such as MPESA or other MFIs that advance this affordable financial.
And finally, it's a wrap for EBN News at 1 p.m. Many thanks for watching. My name is LETICIA AFANDI, and enjoy the rest of your viewing.